This is a short explanation of the electronic pre-op assessment system at York Hospital. The first screen I'll take you to is the input screen first seen by the nursing staff. I've hidden the patient details in this case. If we zoom in on this screen, you'll see that we record details about the date of assessment, the nurse performing the assessment, and the date and the intended procedure to be performed. We'll zoom in and you'll see there's a series of tabs as you move across the assessment, which makes it easy for the nursing staff to navigate. If we start with the anaesthetic, we've got anaesthetic history, which includes things such as MH and scoline apnea, also a full airway assessment and oral hygiene. We also have a bit about other important areas such as cervical spondylosis. If we then look across, you'll see that we have a section about venous thromboembolism and doing the VTE risk assessment. And if I go into this, you'll see that it basically follows the national tool to meet the VTE prevention quality standard. So there is a full assessment using the tool of both the risk and the risk of bleeding. Once we've completed that, the nurse can move on to, in this section we'll go to past medical history. Here it pulls through any history within our core patient database about admissions, operations and planned activity. This section over here allows us to record some more data, and there's nothing on this patient, so let's look at one that's slightly more complex. You'll see the chevrons. If we click on the chevrons at the side, if we want to put in operations that are not included in our system, we can put in the date, the specialty, the procedure. If we open the specialty bit, there is actually a drop-down menu choice of specialties. It also offers the opportunity to put in which hospital the procedure was done at. I'm not going to save any changes on this occasion. Again, if we look at the chevrons, we've got recorded chronic conditions. These are conditions that are already recorded on our core patient database, and up here we can see that this patient is highlighted as having hypertension, and we can also look under the details section and see which consultant's firm they were under when these chronic conditions were recorded. Again, we'll close this one. We can put in details about previous surgical complications. Again, that puts us into a free text editor where the nurse can record any detail. Again, we won't record anything for this patient. And also similar free text editor for assessment notes. If we now move across to medicines and allergies, you can see, if I zoom in, there is an extensive list of medications, everything from oral contraception, but also including things such as clopidogrel. We also have a link, as you can see here, to primary care, and we can actually view the primary care summary if we are allowed to have access to it. Medical problems, if we look at this area, we'll have another look at a more complex patient. I'm just going to demonstrate moving to a patient from a theatre list, which you'll see more of later. If I just have to click on the chevrons, go to surgical pre-assessment, click on OK, and this will take me to a more complex patient. And so if we zoom in on this patient's medical problems, you can see we now have a choice of tabs again. At the top of each one there's a choice for no history, but in this patient there's hypertension, which is controlled on medication, but also we can record valve problems and whether they have a pacemaker. Moving across, the respiratory issues such as asthma, sleep apnea, sputum production and smoking history and exercise tolerance is dealt with. If we look under others, you come to the neurological system. Down further, endocrine system, this patient is diabetic on a diet control. And then under miscellaneous we have various things which includes kidney urinary problems, and this patient has prostatic cancer. We move on to observations. These are input manually into the system currently, but with an automatic calculation of the BMI. Moving to tests, when you click on this you'll see that the system automatically searches our database to get the full readings that are currently within the system, and you can look at full blood count using these, shows a high urea in red, liver function tests, and looking at others again, another one showing up in red, which is the hemoglobin A1C. If we look at others, there's an extensive list of other tests that can be done, including our own CPX testing. Moving on to the social system, it says whether the patient is coming to the day unit or extended stay, whether they have someone at home, whether they have their own transport, and what their patient carer arrangements are. The patient lifestyle is aimed much more at the inpatients, and this is a unified system dealing with day cases and inpatients, so it helps deal with patients who've come through and are not suitable for day surgery. There are also areas for housing assessments where appropriate, and also information that have been provided. So the day unit standards, patient anaesthetic, leaflet, dietary advice, etc. And then we've got choice of patient referral. The most common one is to use the referral to the anaesthetist. Looking at this patient here, we've got auto text is pulled through that this patient has a high BMI, and then at the bottom we can put in our anaesthetic response to this. Here's another one, a patient who's on warfarin with the details, again reviewed by one of our consultants. So how do we manage this system? We needed a way to highlight problematic patients. Previously we'd used really ad hoc arrangements. Within the day unit, problem patients were printed out and put in a box for me to review. In other areas they were merely put into the internal mail, which really was a recipe for disaster. So we introduced the concept of work lists for the anaesthetic department and for those responsible for pre-op assessment. So if I go into the theatre, into our CPD system, I can show you me going into one of these work lists, which is quite quick. I'm going to select patients for pre-anaesthetic involvement in the day unit and pull up a list of patients that are waiting review. If I move into these, we can then use the chevrons to select a patient. So we'll select this one. We'll go in, look at surgical pre-assessment, press OK, go into this patient's assessment, and you see it says awaiting anaesthetist response, and it says that the patient is hypertensive, newly diagnosed, so we can click on the observations and see what the 3 readings were. Also note a low BMI. So we can go back to this page. As soon as I click it, it recognises that I have reviewed this patient. I'm not going to show the referral on admission, and you'll see some more about this later. So I've taken responsibility for having reviewed that patient, and they disappear from the work list. Once again, if we look for another patient, we can select another one who's had issues, chevrons, go to surgical pre-assessment, OK, we're straight in. This patient shows an anaesthetic family history problem, and I can look to see whether they've had previous operations, and they've had no previous procedures in this hospital. In this case, I can choose to go back to the clinical desktop, which allows us to look whether there have been any procedures performed for this patient, and there haven't. I can look at the patient letters if I wish, and so I'm going to review this patient, and I don't believe there's any need for this patient to be highlighted, and I'm going to apply. So I've taken responsibility for having reviewed that patient, and they've removed from the list. Finally, we'll show one more. Chevrons, surgical pre-assessment, OK. And here we have someone with headache seeing a doctor. No need for me to go any further. No need for this to be highlighted on the operating list, and I press apply. And another patient has been removed. So the question is, how do we interface this with the theatre system? Again, I'm going to show you from scratch, going into our core patient database, go up to theatre utilisation. This shows you the work list for the day unit for the week beginning the 30th of May. I can click at the bottom between the day unit and main theatres, and you'll notice there's very few things, but in the UK that was the school break week. I can go back to the day unit and in fact then select the following week to show you a more typical week in the day unit and main theatres, somewhat busier. And then if I go back to the day unit, I can select the list I'm doing by double clicking. On this list I see there's no alarms, but I can go to the first patient, click on the chevrons, go to surgical pre-assessment, and taken straight into the assessment. I can flick through the various headings to see if there are any issues with this patient. I can see that they're on microgynon and mibevrin. They've got no allergies. I can go to medical problems. Again, no history. I can check under others. I can check on tests and observations. Again, everything's fine. Check test. That will bring up the latest results for the patient if there are any on the system. This takes a moment to populate the results depending on how many there are, but I can quickly go through them all and see that there is no problem with this patient. And so, having checked through the pre-op assessment, I can then close it down and go back to my theatre list and repeat it for the other patients on the list. Now if I go to a list that has got some problem patient on it, select another list, this is 2 weeks ahead, you can see there are alarm notes, and if I click on them it says pre-op assessment needs reviewing. That patient's been cancelled due to administration, so we'll look at the next one. Again, there's a pre-op problem that needs reviewing, so I can go into the surgical pre-op assessment, click OK, and go straight in, and it will take me to the referral reason. And here we see we've got a patient with a high body mass index and hypertensive and not on any therapy. Note that the nurse has advised the patient to stay in overnight, whereas my colleague has reviewed the patient and said they do not need an ESA bed, and has actually put it for further action of the nurse. But we'll also maintain an alert on the system so that the anaesthetist knows that this patient has a high body mass index when they come in. Once again, back to the list. Now I'm just going to close this down, close down the system, and then close this down altogether to demonstrate I've done this all from home on a standard broadband connection and without any fancy equipment. Thank you.